fall is the perfect season to slow down and examine your health and wellness. Joining me in the studio is our Chief Medical Officer of Health for the region, Dr. Azim Kasmani. Dr. Kasmani, what can we do to stay healthy as the seasons change?
Yeah, thanks for having me today. I think it's a great time to remind ourselves of all the important things we can do. So we often talk about things like vaccination. As we head back to school, we know in the fall especially people gather indoors, the weather's getting colder, people tend to get that first cold of the year or of the new school year, especially 2, 3, 4 weeks in. So there's a number of things we can do. We can get our vaccines against the flu later in October. We can get our vaccine against COVID when the updated strain comes in. If we're eligible for other things, getting those vaccinations is really the best way we can minimize our side effects and build some protection against things we see passing along.
Speaking of vaccinations, the province did make an announcement a couple days ago regarding vaccinations. Can you tell me a bit about it?
Yeah, so there's a few different ones. There's a new vaccination program for RSV. RSV really tends to affect really little kids under a year or the elderly, as well as folks with other medical conditions. And so to find out whether people are eligible, they can go to our website, niagararegion.ca, and they'll see the links that are available. Then we know that the annual flu shot, that's going to come out likely in October. We start with those at highest risk and then move on to the general public from then. And there's a new updated COVID vaccine too, and that'll be coming around the same time soon.
As the weather gets colder, we get a little more depressed because we're inside. The dog's not getting as many miles and stuff like that on him or her. What can we do to stay active in the house if we want to avoid being outside?
Yeah, so in public health, we're all about prevention because an ounce of prevention is worth a pound of cure, as we all say. And we see that staying active, staying healthy, that'll help us in the long term as well. And so there's many different ways. For some folks, if you're working from home, for example, you might find over lunch you can get out and have a walk around the neighborhood if you're able to, taking the stairs instead of the elevator. For seniors, for others who might have mobility issues, it might be a bit more of a challenge, especially outside when the weather gets bad, icy, slippery, going to places like malls, for example. Staying active and being social is also really important. And I know pickleball, for example, is a sport that's really picked up because it's a low barrier to entry. Many of our different municipalities have courts available, or we see at the YMCA or your local rec center. There's all sorts of activities we can do. I think some of our colleagues curl as well. So all sorts of things we can do to get out there and get moving a bit.
And I think it's important to realize that, there's a difference between, going for a high-intensity jog versus an activity. Can you kind of explain what those differences are and what their benefits are?
Yeah, and one thing we got to keep in mind is that if you want to do that high-intensity stuff, you got to train up to get there, right? You're not going to run a marathon just fresh out without any training. And so everything adds up. That little bit we do daily, weekly, it all adds up and it all makes it easier then. But starting with something within our limits, many of us may have some physical limitations, or maybe we haven't done it in a while. And so building up gradually is always great and staying that consistency. But it all adds up, it all has some benefit.
And the region will be on the road with some mobile clinics, is that correct?
Yeah, so as the school year starts up, we do a lot in schools. We have our nurses in the schools, especially in high schools. We have dental hygienists and our dental team going out and doing work in schools. And so that's a big place we are. And then we also have a dental mobile bus. And that dental mobile bus offers services through federal and provincial programs to seniors as well as young folks who don't necessarily have coverage. Again, if you go to our website, niagararegion.ca, there's a lot more information on who qualifies, but we'll be going to areas around the region that have the highest need and providing service there.
I hate to say the C word, but I'm going to bring up the word COVID, even though, we're pretty much past the pandemic, but COVID's still a thing, is that right?
Yeah, and it's never going to go away. So it's now an endemic virus, like many of the other viruses we see. Actually, the common cold is also caused by, or some of the common colds we get every couple of years are caused by a coronavirus too. So it's not just within circulation. It still can cause some people to become extremely unwell, needing hospitalization, ICU, or even unfortunately passing away. So we still want to take precautions. The best thing is getting that updated COVID shot when it's available. And that's the way to get immunity, to fight it off, to give our body that that instruction manual on how to deal with the virus without the same level of side effects as getting sick.
The last point I want to bring up, I know the region doesn't do acute care, but staying in touch with your primary doctor, using telehealth, those are all great ways to keep on top of your health.
Yeah,
is that right?
There's a number of different systems in place. So I know that there's a shortage of family doctors at the region. We do have a physician recruiter working to bring more doctors into town, working with our local area municipalities, the hospital system in order to strengthen our primary care presence, and that has a big public health impact as well, because the more people who have that availability of a family physician or a nurse practitioner or that healthcare provider, the more we can get things dealt with early on ahead of time. And then there are those other services available, like you noted, like telehealth, potentially walk-in clinics if needed. So
get vaccinated and keep those hands nice and washed, is that right?
Yeah, wash your hands. Stay away from other people when you're sick as best as you can, and we've got to make it easy for people to do that. So talking to the businesses, talking to other people, and having those programs in place so people don't have to come in to work when they're sick, that's going to be key too.
Thanks, doctor.
Thanks for having me.